Next up, we're going to be looking at another innovation. It is called benshi.ai, and it's very much in a space that Netexplo is interested in, the democratization of healthcare. Let's take a look. Okay, well, as we saw there, this next innovation, our third of the day, is called benshi.ai. It's developed with an NGO in Barcelona, and it seeks to improve existing healthcare applications in developing countries by using machine learning and behavioral prediction. Well, let's take a look at the practical application for benshi.ai. Every day, 800 women and 14,000 babies die from complications related to pregnancy and childbirth. Now, benshi.ai aims to equip midwives, amongst other medical professionals, with knowledge and resources to help them and therefore reduce maternal mortality. So a really important innovation here. And Marcus, benshi.ai is an example of the democratization, I seem to struggle with that one, of healthcare, thanks to the humble mobile phone. And this is something we've looked at quite a bit at Netexplo over the years, phones helping to democratize a given sector. Lots of evidence over these last 15 years.
Definitely. In fact, if we go right back to the very early years of Netexplo, one of our award winners was a mobile banking service called Wizit from South Africa. And in fact, more or less at the same time Netexplo came out, there was an innovation from Kenya, which was a game changer for the entire world, called M-Pesa. And the idea was that why can't you leapfrog several stages in technological development using a mobile phone? And in this case, use a very simple mobile phone as a banking account. So millions of people that were unbanked, that didn't have access to finance, could use their mobile phones to receive and send money. It was much safer, much more efficient. And that was one example where developing countries led the world to some extent, because we didn't have text message money transfer in the West, in Western countries, from several years after that. And we've often featured frugal, smart mobile apps that help healthcare, very often for midwives, very often to register births, to encourage and to put out communication and campaigns on different infectious diseases. And as so many people in Africa, for example, have a mobile phone, it's a fantastic channel of communication and of changing behavior, and very useful for bringing healthcare to remote areas or areas where they don't have necessarily specialists or doctors. So, and then the idea with Benshi, what if you take all that data, all those services, all those tools, and apply AI to it? What could you learn? Well, that was really what we found most interesting about this innovation.
Yeah, so accessibility, once again, being a buzzword here, the democratization of a sector. Well, we spoke to the founder of benshi.ai. She's called Africa Perianes, and she started by telling us a little bit more about just what benshi.ai does.
benshi.ai is a tech organization that focuses on bringing AI technologies to low and middle-income countries to improve healthcare outcomes. We work together with the Bill and Melinda Gates Foundation and our partners to integrate with mobile health apps because they serve as a unique communication with patient and frontline health workers, and also a unique source of information in terms of data, behavioral data. So we can understand behaviors that they were never analyzed before. And we can also use this information to provide adaptive interventions for frontline health workers and also patient side.
And tell us, where did the idea come from, and what does the name mean?
So benshi is a profession that exists in the previous century in Japan. So in silent films, there were subtitles, and benshis were those people that were explaining to the audience what was happening in the film. And this is how we see ourselves, as those people that is explaining to our partners what is happening with their data. And also, myself and part of the executive team, we were working before in Japan. We were also working in machine learning in the video game industry at that time. So this is also kind of a link of our past working together.
So how does AI improve health outcomes?
So as I mentioned before, we are integrating with mobile health apps to first organize the data and also label it with the right format, and also being able to predict behavior of frontline health workers and patients, and with the goal of provide just-in-time adaptive interventions with the right information or the right incentive in order to improve healthcare outcomes. We focus on epidemiological diseases as malaria, tuberculosis, HIV, or even COVID, and also in working with pharmacists, because they are the primary point of care of the healthcare system for most of the people in the world, and also with maternal care. So, for instance, in the case of malaria, so we try to fill the gap of sometimes broken healthcare system. So we try to provide the right incentive or the right information at the right time to pharmacists in order that first, I mean, they have always available malaria test in the pharmacy. Second, before providing or prescribing directly the drug of malaria, patients need to provide to perform a test, and only in the case it's positive, they will receive the drug. And also on the patient side, also provide the right information and the right incentive in order that rather than take the malaria pill or ask for it directly, so they wait 15 minutes and they perform the test before being taking the drug directly, because this provokes resistance to the medicament, and it can have very serious consequences.
And can you give us an example of how it makes a difference?
So our mission is to bring those technologies that are currently impacting our daily life to an area of the world that never had access to them. So, so an example is, for instance, we focus on behavior. Okay, so we are analyzing data sets that were never analyzed before and can bring us a lot of information about behavior of healthcare workers, behavior of pharmacists, behavior of patients. So first, understanding this is already fundamental. Second, with this information and this channel of communication, we can send adaptive interventions. So behavior can play a crucial role on addressing or improving some of the worst diseases in the world. So for instance, HIV, okay, HIV is most of it behavioral. So be able to provide information of prevention guidelines or adherence to treatments can have a tremendous system for public health in many countries. Another example is the case of malaria. So performing a test before or not taking the drug can also change completely, how this, the diagnosis of this disease, and also the usage of mosquito net at night can also have a tremendous impact on control it.
And where is benshi.ai being rolled out?
Currently, our area of focus is Africa, is also India and Southern Asia. So we are having collaborations with the public health institution in Ethiopia, and also, for instance, in the case of diabetes, we are working with the World Diabetes Foundation, and maternal care with Maternity Foundation, also covering Africa and India.
And just lastly, what are your plans for the future?
So, well, we have many plans. Indeed, we are growing a lot, and our mission is to democratize AI-based interventions. So we want to expand to all the diseases I mentioned before, but also have physically presence in most of the areas that we are working with our partnerships to work together to solve this challenge. So we are also immediately opening offices in Nairobi right now, and also in Lagos very soon, and Kigali, and the next ones are going to be Cape Town and also offices in India.
Okay, and that was Africa Perianes, the founder of benshi.ai, speaking to us a little earlier on. Really interesting, that innovation, Marcus. And I learned a new word there, a benshi. Did you know what a benshi was?
I'd never heard of that, and I suppose it makes sense. You can imagine silent movies, maybe from Hollywood 100 or so years ago, being seen in Japan, as well as the captions on the screen. They needed somebody standing next to the screen explaining why there were people in funny hats on horses shooting at each other, because it was obviously culturally very different. And I think that's how benshi.ai got its name, because they see themselves as the interpreters of behavior. And it was very interesting for us to see how AI with the right data can be used to make behavioral recommendations, just to nudge people in the right direction, whether it's taking tests, taking vaccines, etc., with demonstrable, quantifiable health outcomes. And that was what we found most compelling about Benshi.
Yeah, it's easy to imagine some of the immediate practical uses it can be put to as well. Let's get the insights now of a professor. Here is Professor Wallace Chigona from the University of Cape Town. Here's what he made of benshi.ai.
One of the technologies from the list of this year's nomination, which I find fascinating, is benshi.ai. So benshi.ai is an adaptive artificial intelligence system, meaning it improves as it gets used. And benshi.ai is used in developing contexts. One of the application areas for benshi.ai has been in healthcare, especially in maternal health care. So as you know, the maternal mortality rate in developing countries is way higher compared to that in developed countries. And one of the reasons for a high maternal mortality ratio is because in developing countries we have limited healthcare workers, well-trained ones, and we have limited technology for diagnosis. So with technologies like benshi.ai, these would support the health workers to be much more efficient in the diagnosis and in the provision of healthcare. Therefore, this could help to save lives. I'm sure other areas where this technology can be used would be in education, in supporting learners, could be in agriculture extension, or even in supporting emerging entrepreneurs to improve their business skills. Another fascinating thing for the technology is in the way in which the data is used. So with the growing use of AI, we've seen that the big commercials would come get data from people in different contexts and use this data to improve their systems, and then don't feed back to the people they got the data from, or even try to sell that thing back to them. What we're seeing with benshi.ai is an example of how ethical data can be used in artificial intelligence. They obtain data from the people, use the data to improve the system and to support the very people they got the data from in a better way. So that to me is ethics and artificial intelligence. So I would wish other people in the AI space would emulate this example. And having said that, I wish benshi.ai all the best in their future as they're doing even more and more things to support people. Thank you.